Life Management Science Labs would like to acknowledge that we live and produce this podcast on the traditional lands of the Wurundjeri people. We'd also like to acknowledge the traditional owners of the lands of our listeners and our international colleagues. We'd like to pay our respects to their elders past, present, and emerging. Hello, everyone, and welcome to Aging Less, the Longevity Science Insights podcast produced by LMSL, the Life Management Science Labs. We are champions of life management science, providing structured insights informed by science and inspired by practice on key aspects of conscious living. Each week, we bring you scientific and practical insights on each element with the expert knowledge of professionals in the field. I'm your host, Marie Stella, coming to your ears from Naarm, Melbourne, Australia. Let's learn together.
Welcome back to the show. In the pursuit of optimal health and longevity, dietary supplements have become increasingly popular. However, with a myriad of options available, celebrities and influencers emerging with their own brands, it can be challenging to discern fact from fiction. So in this episode, we're exploring the science behind dietary supplements, and guiding us through this is dietitian Dr. Dalia El Khoury. Also a professor at the University of Guelph, Dalia's research interests primarily focus on the role of functional ingredients and or foods in the regulation of appetite, food intake, glycemia, and metabolism in both healthy individuals and those with nutrition-related disorders. So we are extremely fortunate to have her here with us today. Welcome to the show, Dalia.
Thank you so much, Sabrina. So nice to be here. Thank you so much.
Before we begin, what are some common misconceptions about dietary supplements that consumers should be aware of, Dalia?
So today, Sabrina, we're going to be speaking a lot about longevity and dietary supplements. And the main misconception that we're going to be telling the listeners is that there are no supplements till now that that was proven to extend your lifespan or promote and increase the number of years lived. So we don't have any evidence yet about any supplements that is able to do that. We're going to speak about lots of supplements that were thought that can be linked to longevity or increased lifespan, etc. But if we're talking scientifically or with clinical evidence, none of those supplements is for sure known to be able to extend your lifespan or make you live longer. And I'm sorry to say that, it's a bit disappointing, but today we're going to make the consumers aware that they shouldn't be listening to any claims that are made about supplements. They have to be very careful when to know about the supplements, to learn about it from their healthcare professionals, including registered dietitians. They have to ask questions to those professionals before taking any supplement. So we're going to talk more about this today for sure.
That's a wonderful teaser for our talk in a few minutes. But before we get further into the topic, we'd like to get to know you better. So this is Have You Met Dalia? Okay, so Dalia, first question. What is your favorite book?
So I'm originally Lebanese, and one of my favorite books is called The Rock of Tanyos, which is by Amin Malouf. This is my second time reading it, actually. It just takes me back to the old times in my home country. It just satisfies the nostalgia in me. Uh, this nostalgia that is an inner feeling that is part of me, irrespective of the number of cities I've lived in and I've worked in, the achievements I've reached in my career. There's always this nostalgia to my home country, and I feel this book always brings me back to these old times in Lebanon. Yeah.
I see. So you're Lebanese. And
Yes.
what movie have you enjoyed recently?
So I have a 6-year old son, and I can tell you that I'm really enjoying lately watching those family movies, kids movies that are family, also directed movies. They're fun, they're light, and they help me get away from the hardships and stress we face on daily basis. So honestly, this is what I'm enjoying so far, just to make me relax and just forget about work and the stress and everything.
I
And I
see.
love spending time with them as well. So that's good.
Yeah, family movies are really light-hearted, and it makes you look at life in a warmer setting.
100%. 100%. Yeah.
Are you listening to any podcast at the moment, Alia?
There's not recently, but I listened a little bit to a podcast by Dr. Sanjay Gupta called Letting Go of the Pressure to Be Perfect. And it's a very nice conversation about letting go of perfectionism without lowering your standards. And this is a very important topic to me. I'm trying to learn how to, let's say, be able to work on my projects, work with my team, meet my duties without being too harsh on myself. And again, we know that perfectionism is a result of a combined social, cultural, familial, personal lived experiences, which is not easy to manage. But again, I'm trying to find ways to work around this feeling of you have to be always perfect. And I always tell my students, as part of my learning journey, is that you don't have to be perfect. This is good and good enough, and it doesn't have to be perfect at all. So yeah.
Yeah, sometimes finding the balance between finalizing the action itself and the perfectionism that is in our heads is something that keeps us apart from what we should have been doing and we should have already finished.
Exactly. Exactly. So, but it's a learning process, right? So it's good. Yeah.
Indeed. And who do you look up to in a professional or in your personal setting?
So I have so many mentors and advisors in my life and all my academic journey and my work journey who I admire. But I feel that my dad is someone who I really look up for. He started from zero. He built himself from zero. He taught us, me and my brother, how to work hard to always be a better version of ourselves while remaining down to earth and ready to support anyone in need. So I feel that like he built himself through lots of hardships, and he kept this positive, resilient, nice attitude while facing all those tough moments in his life. And really, I really look up to him strongly.
Wow. Having such a wonderful figure in your life must be an amazing inspiration.
Yes, 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 yes.
And last question, is there a course that's stuck with you to this date that has inspired you?
Actually, one of the courses I first taught as a lecturer in my home country at the American University of Beirut was medical nutrition therapy. And luckily, I'm teaching it now at the University of Guelph. And in this course, it's about exploring diet and diet therapies and as a way to deal with a number of chronic conditions. And I feel this course is a reminder to everyone that dietary habits and diet therapies are essential components of someone's journey to prevent and or manage their chronic conditions or diseases. And also it reminds us about the important role of registered dietitians within the healthcare system and the healthcare team. So that's why this course, before and now, is still like one of my favorite courses. And I'm so lucky I still am able to teach it here.
And I believe that is the perfect segue to jump into our topic, which is the science behind dietary supplements, what works and what doesn't, since you are delving into that world as a dietitian. But for starters, how would you define longevity?
So longevity like first let's start with aging. Let's talk about it as a normal inevitable part of our life, which is there's no simply there's no way to stop it altogether, right? But when we speak about longevity, the first thing that would cross my mind or our mind is not just living longer days in comparison to the average life expectancy in a certain population, but like living longer and healthier and healthy days, like living a good quality of life, not just a longer for a longer period of time, just living it also with a good quality of life, having an optimal longevity, living long but with good health and good quality of life. And this has led to what we call now the geroscience or geriatric medicine, which is this nice interdisciplinary field of research aiming to understand the different mechanisms between aging and the aging related diseases and mechanisms, and how what kind of therapies or what kind of dietary interventions or approaches and lifestyle approaches can be developed in order to slow down the development of those chronic diseases, and in a way allow the person to live longer and healthier, knowing that with aging the risk of multiple chronic diseases can increase, and we know many of them, including osteoporosis, cardiovascular diseases, even cognitive decline, Alzheimer, etc. So these are all kind of a result of aging. And through the geroscience or geriatric medicine, we're trying to understand what can slow down or even delay or prevent the development of those diseases with aging to help individuals live longer and healthier.
Wonderful. And as a registered dietitian, what is the definition of a dietary supplement?
So let me start because this is a very important topic when speaking about supplements. So the term supplement may have different definitions in different countries. There's no one
Mm,
answer to that. Okay. On top of, again, I will speak later about that, the different regulatory frameworks among
mm,
different countries that regulate dietary supplements. But in general, when I say supplements, it means anything that can be taken orally to support your diet or supplement your diet with the needed, let's say, nutrients or functional ingredients. So they usually must be safe generally, and they're sold without any prescription. And they come in different forms, including but not limited to tablets, capsules, soft gels, powders, bars, gummies, and liquids. Now, I'm going to give two examples of how, let's say, in my home country, in Canada, they call it the natural and non-prescription health products. The natural health products, which are the dietary supplements, they fall under this category, and they can be anything from micronutrients to herbal remedies to traditional medicines, omega 3s. We're going to give some examples later on, essential fatty acids, probiotics, anything that you take orally that's not medicine, that's not drug, that can supplement your diet with the needed nutrients or functional ingredients. Also, it includes botanicals, vitamins, minerals, of course. Sports supplements, which is not the focus of our talk today, but I have lots of research on sports supplements as well. So that's according to the Canadian, the Health Canada's definition. And also you have the FDA, the Food and Drug Administration. They also define dietary supplement as a product containing either vitamins, minerals, herbs, amino acids, any form of dietary substitute intended to supplement your diet.
I see. So, because most of the time people would know like tablets or capsules or even nowadays gummies. And I didn't know that herbs, like herbal remedies, can also be included in Canada's terms at the very least.
And even the USA, so they do have the vitamins, the minerals, of course, the botanicals, amino acids, even the probiotics, which are the live microbials. These are also considered dietary supplement. And as you said, the yes, botanicals go under there for sure. Like there are different examples. We're gonna speak about some of them later, like curcumin, echinacea, ginger, etc. They all fall. Amino acids even fall under this category. So yeah, it's a long list, but these are the common types that are generally considered dietary supplements.
As we mentioned, there are a lot of various types of dietary supplements available in this world. So, what do these dietary supplements usually contain besides vitamins?
Oh yeah, I mean, again, when I say dietary supplements, it doesn't mean only vitamins. They are a huge variety. Vitamins and minerals, as you mentioned, Sabrina, there are very common types, right? That's why we say, what vitamin are you taking? What mineral are you taking? Because they're very commonly considered, like commonly consumed, right?
Yeah.
But again, when you check and this is again should be mentioned on the list of ingredient or the label when you're checking a supplement, you will anything herbal, botanical, enzymes, even sometimes some example of enzymes can be
Enzymes.
found there, fiber, some like type of fibers, when given in a large amount as a condensed concentrated form, we consider them supplement. Fatty acids, probiotics, the live microorganisms, amino acids, creatine, and others. So all these do fall. Even I like caffeine can fall under
Mm,
those supplements because we find the caffeine capsules, etc. So that falls also under the category of dietary supplement.
I see. So coffee is part of supplements?
Not coffee, the caffeine, which is the active
Okay.
ingredient. I mean, coffee is not a supplement, no. But the caffeine, the active ingredient in coffee, when it's given in a, let's say, in a concentrated dose, this is considered a form of a supplement for sure. Yeah.
I see. So when only taken the active ingredient itself, it can be taken as a supplement. And what role do dietary supplements play in our overall health and longevity?
Okay, so since we're talking about health and longevity in particular, again, before starting this discussion, I want to make sure to remind the listeners here that I'm going to be speaking about some examples of supplements that were considered or suggested or even found in some studies to be linked to, let's say, a better metabolic profile, better antioxidant. Activating antioxidant systems in the body, etc. Anything that can be linked to mechanisms that can extend lifespan or health span. There are some studies on some of these supplements, but again, to date, there is no evidence on any of those supplements that for sure they do expand your lifespan, they do make you live longer. We don't have any evidence on any of these supplements. And still till now, and this is again based on recommendations from different countries, including Canada's Health Food Guide, the USDA or the US Food Guide Pyramid, they do talk about the importance of following a healthy diet, being physically active, and a number of lifestyle changes you need to make in order to manage better your life, reduce the risk of diseases, and then in a way, this can translate into living longer with better functionality and less diseases. So, according to the guidelines, we always say that the best way to get nutrients or get your nutritional requirements is to eat healthy or get it from the food rather than from the supplements. And the supplements are recommended only for those who cannot get enough nutrients from their diet or they're deficient in certain nutrients, and need to get it from additional sources other than food. And that's why I say that taking dietary supplements is not something that is something that should be very well guided. It cannot be something that you do it just because your family is doing it or your friends are doing it, etc. It's because you're consulting with a healthcare professional. They're taking case by case and checking what's going on with you, with your body, with your blood parameters, and then they tell you whether you need a supplement or not.
I
So,
see.
to go back to your question, and there have been lots of interest in exploring the role of supplements in longevity and aging in a healthy way. And there have been lots of studies going on. Mostly they were studies on animals, or let's say
Mm,
cellular levels, like in vitro, we call them studies. And some studies on humans were done, but those studies on humans, we still consider them not enough, and they should be, let's say, on larger sample size from different, let's say, ethnicities, age groups, sex groups, sex identities, let's say from different countries. We should have them over a longer period of time to follow people over a long period of time to see whether really those supplements intake is going to translate into living longer and healthier. Again, I'm going to keep saying that again. There were lots of beliefs that say in antioxidants. You hear
Yeah.
about that. And the coenzyme, such as coenzyme Q10, melatonin, vitamins E, A, and C, resveratrol, and others, vitamin D, even curcumin, etc., omega-3 fatty acids. All of these are thought to have some benefits on the body, and they do have benefits on the body. But again, most of the studies were done on animal models, which doesn't
Ah.
mean work on humans, right? And even some studies, and I want to tell you a very recent study done in the USA, they found that if you take those supplements sometimes and you don't need them, you might have negative outcomes.
Mm.
So for many of those antioxidants, they found that, and even like especially beta carotene, vitamin A, and vitamin E, they found that if you take them and you don't need them, you might have unfavorable health outcomes later on, such as increased risk of mortality.
Oh.
um, yeah. So one of the latest study in the USA, they did this nice cohort, very large cohort. They had a very large number of people, like 300,000 participants, and they were followed over 27 years, let's say. And in this study, they found that, for example, a daily multivitamin use, mineral and vitamin use, it's a combination, was not associated with living longer, and even it was associated in a way marginally to dying earlier. So it didn't translate into benefits to the individuals. And I can tell you, Sabrina, that one major reason for that is that those studied individuals were well nourished individuals.
Mm.
They were not deficient in those nutrients or in those vitamins and minerals. So maybe they didn't need it, right? And that's why it didn't benefit them. So that's why I say, when you see a healthcare professional, they will check your let's say they will do a blood test and they will check the blood levels of those nutrients, and they will check for in different ways, not only blood levels. They can do different assessments to see whether you are really in need for those nutrients or not before taking any supplements. So that's another important message to everyone listening.
That's a very interesting intake, especially when you said that there are people who take vitamins that don't necessarily need it. So, my question to that would be, what kind of tests or what should we ask our dietitian or nutritionist to understand our body better, and what types of vitamins that we need or what supplements that our body requires?
Yes, that's a great question. So, when I speak to my students about the different types of assessments, there are two main ones I'm going to mention here today. There are different types. You can do dietary assessment, we call it. Dietary assessment is when the dietitian will ask the patient about their dietary intakes. They do, like, let's say, a 24-hour recall. They ask about,
Yeah.
or they do a detailed assessment of their habitual intakes, habitual diet, and they can enter it into a system, into a database, and do analysis of the dietary intake of those individuals, and assess all different micronutrients and macronutrients, all different vitamins and minerals, and to check whether the intake of those vitamins and minerals, for instance, is meeting the dietary recommendations for those individuals. If they meet their recommendations, the dietary recommendations, then they're fine, right? If they fall short and they don't meet those recommendations, then we start talking about possibly a risk of deficiency. And another thing you do on top of that is, again, there are many assessments you can do, but another important one is what we call biochemical assessment. And this is when you take the blood from individuals and you assess different markers and metabolites that can give you an idea how their body's functioning, and whether it has enough storage of different nutrients, and whether there is any risk of deficiency in there. And that can give you also an idea about what's going on in their body. And based on those assessments, the dietitian can define with the patient what's the best approach to deal with any, let's say, also they assess risk of diseases like the family history, right? Any family history of different diseases can also give you an idea about the patient's risk of diseases, and how to better what's the best approach to prevent them from developing those diseases in the future. These are some examples.
I see. And my next question would be I'd like to go back to prebiotics and probiotics, which is getting more of a recognition nowadays. So, what are they, their difference, and what are their importance?
Yeah. So this is a great question because the what we call the gut. So let me define first probiotics. Okay, there are these nice
Mm-hmm.
group of community of non-pathogenic
Mm.
microorganisms that are present in our distal part of the human GI tract. Okay, our gastrointestinal tract. The distal part of it, it has bacteria in it, right? Or microorganisms, and those are good. Like they are good and bad, but the nice balance between the good and the good and bad bacteria in our system, what we call it the gut microbiota. Okay, and we want to have
Mm-hmm.
as many good bacteria in there and non-pathogenic microorganisms as possible. So there were lots of studies, and there are lots of studies now lately coming out, trying to link between the link the trying to find the link between the gut microbiota and so many different risks for diseases. So your gut microbiota, it seems, because of those microorganisms in there, because how they can interact with different parts of the body, how they can send different signals and interact with the blood, with the brain, even. We're finding lots of association between the gut microbiota and, let's say, your brain health, your ability to, let's say, your ability to control inflammation, your level of inflammation, your ability to control your immunity, your immune system, your ability to control appetite, even because they interact with the appetite regulating hormones. So, and they also affect our oxidative stress, the oxidation levels in our body, which all are linked in a way to how healthy we live and how long we live, right? So there is now this kind of increased interest in probiotics supplements, right? You find them as supplements on the market. And because people are thinking, and there are lots of studies coming out about how probiotics and having a good and probiotics are also those, they are the live microorganisms that you take and you're trying to fortify and support the live microorganisms that you have in your own gut, in your own gastrointestinal tract. So people, like, there are lots of studies showing that those probiotic supplements may, and again I say may, reduce your risk of developing lots of diseases, including cardiovascular diseases, including a cognitive decline and others in the future. But because we have so many bacterial strains, we have different strains, we have different types of bacteria exist. We have billion types of bacteria that can be present in our gut. That's a main challenge, to be able to know whether taking those bacteria orally is going to be able to reach properly our the distal part of our GI tract and
Yeah.
support our gut microbiota. Maybe they won't reach there. Maybe they will be deactivated by the time they reach
The
the
stomach.
distal part of the human gut. Exactly.
Mm.
So this is something, and even the strain, which strain is better than the other? There are billion types of strains. So studies are trying to figure out which combination of strains is the best combination, which one will be the most uh, like beneficial to our system. And again, also it's case by case. Maybe what works for you doesn't work for me, right? So this is another question about whether those bacterial strains work for everyone. We don't know yet. Does it work the same to everyone? I don't think so. And that's another challenge, right? So this is
Yeah.
the story of probiotics. Yeah.
And we did mention a little bit about a study where the study follows people throughout 27 years, and in some cases, it doesn't even help them mortality wise. And are there other scientific evidence supporting the effectiveness of such dietary supplements in promoting health and longevity?
Again, I will tell you some examples on different supplements, but again, I will tell you at the end of the day, there is no, still we need for all those vitamins, minerals, etc., and botanic herbs, we need longer term studies, which means well designed studies with a very large sample size, like the one I talked about from the US, let's say, following people over a long period of time. And also, like, this is the type of studies we would like to see for every single supplement out there, right? um, we also would like to see more studies on unhealthy individuals, because many of the studies we see are on healthy individuals. We need to have more on unhealthy individuals, individuals with medical conditions, individuals who have existing nutrient deficiencies, right? So that we understand how those supplements will benefit those people who are mostly in need, rather than just a generally healthy individual. I would like to see more studies on, let's say, um, like more on the sex differences, what we see between whether we will see results similar in men versus women, right, or in different age groups, right? So this is another thing I would like to see in the future studies. But let me tell you some examples on, let's say, vitamin, like some examples on what has been done so far, right? So from the vitamins and minerals, I can tell you vitamin D is one of those supplements that's also being very increasingly studied, because vitamin D deficiency, and that's the study so far, is showing that vitamin D deficiency is associated or linked to a large number of diseases that can affect your aging and healthy aging, such as some forms of cancer, some forms of diabetes, cardiovascular diseases, even some problems in your immune system. Um, but in those studies, they're not there. There should be more studies again, to because we worry about the risk of toxicity with vitamin D. So, because if you take vitamin D more than what you should be taking, and more than what your body needs, you are at risk of toxicity, and that's something we don't want, right? So, when talking about vitamin D, especially for people who are vitamin D deficient, vitamin D supplements will be very helpful for sure. But that should be done under professional guidance, right? To make sure that we're giving the right dose and we're not reaching any toxicity level, right? Another one I want to give you an example, Sabrina, is magnesium.
Mm.
Magnesium is, again, when we speak about magnesium, I found lots of studies speaking about how magnesium deficiency has been associated with increased risk of some form of mortality, some forms of cancer, because again, and also some forms of cardiovascular diseases. Um, and again, most of the studies were on people who are showing how magnesium deficiency is associated with those diseases, but and how also magnesium is an important. It's required to convert vitamin D into its active form, so it's linked to vitamin D as well. So this is another supplement that can be of interest to those wanting to prevent risk of disease in the future. But again, we still need more studies on that. I don't know if I should speak on more examples. Like omega-3 is another one, fatty acids. I don't know if you heard about them. Omega-3, they're the one
Yeah,
that comes from
for
fish,
the
like
brain.
the EPA
Yeah.
and DHA. Exactly. They're very good. They're very important for, especially for children and infants, for the brain development, but also in later in life, it's very important to maintain good levels of EPA and DHA in the blood, because it was found that especially in older people, they have lower levels of those EPA and DHA, and that can affect their immune system, that can affect their risk of mortality, that can affect the functionality of their brain and central nervous system, right? So
Yeah.
there is a link between deficiency in those in those fatty acids and the risk of different forms of diseases, but also the role of EPA and DHA in the development of cognitive declines
Alzheimer's.
like Alzheimer's, Parkinson's, schizophrenia, bipolar diseases, and depression is being reviewed. And we have some studies, I want to tell you, some randomized controlled trials. Even some of them are on schizophrenic individuals with schizophrenia, that showed that omega-3 fatty acid supplementation can slow down the degeneration of the gray matter, and can kind of slow down the progress of their schizophrenia. Even that was shown with supplemental fish oil in older adults. It can kind of um, slow down the cognitive decline, right? But we still need more studies on that, right? We need larger studies to confirm these findings. Do you want me to speak about some more, or that's a good example of, these are some examples of what is available in the literature to date? Let me know.
Yeah, I'd like to ask about in the Journal of American College of Cardiology. You've mentioned about randomized controlled studies, and the Journal of American College of Cardiology did an analysis of 170 randomized controlled trials. As it was published, it was found that popular supplements like vitamin C and calcium are mostly useless unless you have a specific deficiency of that vitamin. As a registered dietitian, what are your thoughts on this and how true is this?
Oh, 100%. This is exactly what I was just saying. It's exactly what I'm trying to say, is that till now, we don't know if you're taking supplements and you don't have any deficiency, is it going to benefit you in any way? Till now, I say, I don't know. We don't know. Don't have a good answer for that. And I have an answer for that, saying that, like the study in the USA showed us, that it might have some detrimental effects on your health. It might have the opposite unwanted effect, right? The problem again, Sabrina, is that the studies we have so far on humans, because I don't want to talk about animal studies. We have lots of animal studies or studies on animals, but does that translate to humans? That's a very important question. And because of the controversy of findings, like I gave you some examples before, but there were lots of inconsistencies in the findings on humans. Doesn't mean all findings on humans in human studies were the same. There's lots of inconsistency. That's why there is a need for good quality, large scale, high quality clinical trials that are mimicking real world, are required to study all those supplements and explore the advantages and the risks of taking those supplements in people in need, like nutritionally deficient, or at risk for developing diseases or for a cognitive impairment or decline. This will give us a very clear answer on when we should be taking supplements and whether supplements are good for generally healthy individuals or not. So, again, I can give you an example, for instance, of antioxidants, right? I said antioxidants are being largely studied and explored as longevity supplements. We talk about them all the time, that because they're antioxidants, they can fight the oxidative stress in the body. They can improve the levels of those antioxidant metabolites. I'm not going to say their names, but in real life, they couldn't find a translation of what they found, let's say in cellular studies or animal studies. In real life, in humans, did not translate into, if you take antioxidants, you're going to have a longer life or a healthier life or a longer life to live. You know what I mean? So even if some findings are good in animals or in vitro and at cellular level, this does not translate into effective or favorable outcomes in human studies. And another study that also caught my attention is a study where they explored people taking multiple supplements. So, people take multiple
Mm,
supplements. This is the normal. Like in my studies,
yeah.
I never found one individual, like one participant taking one supplement. They usually take multiple types of supplements. And this is another risk we're going to speak about a bit later, is that the risk of taking too many supplements together, how they can interact together, how they can uh, cancel each other sometimes. You're taking one,
Oh,
they can cancel each other or even affect the effectiveness of some medications you're taking. So that's another thing to keep in mind. And they found that those individuals who, let's say, taking multiple supplements, they were taking so many, 10 different dietary supplements. They assessed the outcomes. They assessed different outcomes related to inflammation, oxidative stress, arterial stiffness, endothelial function, cardiometabolic risk factors. And they found that there was no improvement in any of those biomarkers. And I think they took They were taking those supplements over a long period of time. It was a nice study where the study was done over a 6 month period, and they followed those individuals over 6 months, and they found that there is no benefit because, again, it all depends. It's all about interaction. Is it positive, or is it going to be positive or negative? This interaction between all these different supplements and the dose. We That's why we need to speak to a healthcare professional. The dose matters. How much you're taking, it matters, and that's another thing. The doses you're taking from the dose for those different supplements can define whether they're going to be effective, yes or no.
Mm. What kind of supplements cannot interact with each other that should not be taken with each other?
So I'm gonna jump into the section where we're speaking about, let's say, we call it nutrient or nutrient drug interactions. I will give you an example, very simple examples. For instance, when you're taking iron and calcium, right? You shouldn't be taking them together because iron can
Mm.
um, it can be, let's say, it can block or decrease the absorption of calcium. So the timing is very important because the absorption of the one nutrient can block or decrease the absorption of another nutrient. Sometimes it can be positive. Like, let's say, if you're taking vitamin C and iron, that's good because vitamin C can help the absorption of iron or support the absorption of iron. But many people take iron and calcium at the same time. This is not useful because they're blocking each other, or they're blocking the absorption of each other, right?
Yeah.
Also give like, there are studies that showed also that some antioxidant supplements were found to reduce the effectiveness. Let's say, I'm talking about drugs now and medicines, the effectiveness of some type of cancer chemotherapy treatments, and that's why when people are taking, let's say, any cancer chemotherapy or any form of drugs or medications, they
Mhm.
should consult with the healthcare professional about what supplements they're taking and what medications they're taking, because also those two, they can interact together, and sometimes they can decrease the effectiveness of one another.
I see. Because from what I know, taking supplements is okay. I did not know that there are certain supplements that cannot interact with each other. Because what what the general masses would probably know is that you cannot take certain vitamins with certain medicines, not other supplements.
Yeah, exactly. That's a great point. But no, it's also with other supplements, the timing. That's why I talk about the timing of when you take one supplement versus the other is very important, based on how they interact with each other, or whether they positively or negatively, or there's no interaction between the two. We need to know that, right? Consumers need to understand that. Um, yeah, that's very important. I'm glad we're talking about that now.
I want to talk about people with hormonal issues, especially people with PCOS. And I have seen that people are taking myo-inositol supplements. What are your thoughts about that? Or should we still talk to our dietitian before taking those kind of supplements?
Yeah, again, yeah, exactly. Especially you're talking here. I'm not very familiar with the effectiveness of the myo-inositol you said. I'm not
Yep.
very familiar, especially with respect to PCOS. This is again a very important. This is another important example on how we should be going back to our dietitian and to our physician and speak about supplement, and like mostly the dietitian if we want to speak about supplement, with the physician if you want to speak about medications, of course. But I don't think there's enough evidence yet for any of those supplements in with respect to regulating your hormones, and
Yes.
whether it's under the PCOS or other forms of hormonal dysregulation. I'm not aware of any, but again, this is something that could be discussed with the dietitian and could be assessed with it, because that, as registered dietitians, we can go back to the literature, we can go back to the evidence, we can go back to what evidence we have so far, and we can talk to the patient about that. And I want to tell you one thing here, Sabrina, because people don't think about it this way, is that many of those supplements may have side effects. and we have safety
Mm.
concerns. I don't know if we're going to speak about that later, but it's very important that I mention about why I'm saying speak to the dietitian. Because in my studies, I have seen many of my participants telling us that they face side effects from taking those supplements. And you wouldn't think about it. You would think that those supplements are available over the counter. They don't need prescription, right? And that's safe. They're generally safe. But some people do face side effects, whether it's a GI issue like nausea, vomiting, the diarrhea, constipation, or it can be an allergic reaction. We have to be aware that they can cause side effects, and many of those cases are not recorded officially. So they are way more than what we see in the studies, because people don't go and report them when they have them, which is sad. um, so the side effects and the safety concerns is something I think about all the time when people decide to take a supplement. There are safety concerns that I want them to think about as well, because remember I told you people take different supplements, right? You might get overdose of certain nutrients when you're taking them from this source and from the other source and from different sources. You might get an overdose of some nutrients, and you can also get exposure to those, we call them toxic metals and heavy metals.
Mm.
These are part also of these supplements. I know they're part in very minute and little amount, right? They're very, very little. But if you're taking multiple supplements, they might become too much. You know what I mean? It's not about only taking one supplement, because usually you take multiple supplements. And then in this case, we're being exposed multiple times to those heavy metals, which are usually present and contaminating our supplements in minute amounts. But when you take multiple supplements, that can be additive, that can be too much of an exposure.
I see. As we are talking about side effects, various regions have different standards and regulations, especially when it comes to the food industry. What should consumers consider when evaluating the quality and the safety of such dietary supplements in their own regards?
So before we speak about some details, I want to mention that's a great question, because again, there are different regulatory bodies regulating in each country, regulating dietary supplements for safety, for effectiveness. But again, I want the listeners to know that um, dietary supplements, they're generally released to the market, and they don't need the approval of any governing body. They don't need the approval of Health
Oh,
Canada. They don't need the approval of the FDA. They don't need the approval. What happens is there is a post-market audit that happens, not pre-market. So once the dietary supplements are already on the market, there might be some random assessment of those supplements on the market. They are randomly audited for quality, for evidence of claims, for what's inside in terms of nutritional content. So the FDA and the Health Canada, they're usually ensuring that they're doing a random audit post market, post release to the market, not pre market. What the medications are the one that are generally that need to be approved by the FDA or the regulatory body. The dietary supplements, unfortunately, they don't need to be approved. They have to follow lots of regulations, but are those regulations enforced? Are those regulations checked before the release to the market? No. It's only after the release to the market. And that's a bit scary, because let's say the FDA will do some, I don't know if you read about recalls of lots of supplements from the market, but that's
yeah, I do.
post release to the market, not before. Only when they hear about, let's say, some side effects that were reported. Only when they do a random audit and checkup of the quality, and they find something unauthorized or prohibited, right? So this is when they start telling the people, okay, don't buy this supplement. It's gonna be it's harmful. It contains these harmful substances, etc., which can be a bit late sometimes, right? So I want people to keep in mind that supplements don't need pre-approval to be released to the market. They get checked after being released into the market. So that's a very important point to keep in mind dietary supplements and regulations around dietary supplements. But we're gonna speak more if you want when about the some more details on what to look for when buying a supplement.
Yeah, and what qualities or attributes should be considered when evaluating if a supplement brand is reputable?
Exactly. So that's where I want to give you some examples of what to look for when getting a supplement, that can give you an idea if a supplement um, is saying the like is claiming something wrong, or can be trusted, right? So there's something that you should look for is something called the good manufacturing practice compliance, the GMP. It's something you can find on the supplement, in the information listed on the supplement, that can kind of give you a kind of reassurance that the company has followed the needed steps to ensure the purity, the composition, the strength of this dietary supplement. You're right. It can kind of give the consumer a reassurance that those companies, they did their best efforts to ensure that there are no wrong ingredients in the supplement. There's not too much or too little of the ingredient. There's the correct dose in there. There's no contamination in there. The packaging is correct, the labeling is correct, etc. And nowadays, the supplement companies are using, I don't know if you heard about it, and it can also be mentioned on the supplement, is called third party certified, third
Yeah.
party testing. The third party testing is a kind of a nice thing to see, which is kind of this third party tester is someone who's not linked to the manufacturer, not linked to the supplement company, who's trying to test, who can test those supplements and kind of ensure or test, approve that the doses are correct, the ingredients are correct, there's no contamination with heavy metals, the claims are okay, are good. It gives the consumer a nice feeling that this supplement has been tested by a third party, not just by the manufacturer themselves. Another thing to look at, and we spoke about that before, the list of ingredients or the label. So check what's in the supplement. Read about the ingredients, check the ingredients. And that can lead me to the third part, where the contamination. And that, I don't know if I mentioned about the contamination, but the risks of for supplements, and I speak about that because I work a lot with sports supplements, and those sports supplements, there is the risk of something called contamination. When I say contamination, it can be unintended contamination or on purpose. And contamination is something that the consumer won't be able to know. But I think and I'm reading a lot of reports lately from the FDA recalling supplements because when they did the testing, they found contamination with prohibited substances. And especially you see that for in herbal supplements, unfortunately, and weight loss supplements. Weight loss supplements, there are lots of cases where they're finding prohibited substances in them
Yeah.
to promote weight loss fast. And those prohibited substances should not be in there, because when the list of ingredients doesn't tell you what's in there, that's misleading the consumer. They should say on the list of ingredients everything in the supplement, what's in there. But many companies are choosing not to display or display every ingredient, because some of them are unfortunately illegal or prohibited. And it's a very important, that's something to again be careful about, given the recalls I'm hearing about lately about different supplements, especially the weight loss supplements. And the third thing,
Mm.
I want to add something more, one more point about the claims. The claims they put on the supplement. So those supplements, they're allowed to make some forms of claims, which is like, let's say, nutrient content claims, how much the levels of nutrients they're having in the product, which is okay. Or let's say how those specific ingredients or nutrients are linked to, can support a particular function in the body. That's fine. These are called structure function claims and nutrient content claims. They're okay. They don't need any evidence to be displayed on the supplement. But there are some claims that say when you read something about treating or preventing something very medical, very like more pharmaceutical, this is when it's not okay. It means there's something wrong. The claims on dietary supplements should not say treat, should not say
Mm.
prevent. It's illegal. It's not allowed. This is becoming more like a treatment, like a medicine, like a medication. It's not anymore a supplement, right? So there are some health. There are also another type of claim called health claim. This is when you're saying, let's say, that this substance or this nutrient can reduce the risk of a disease. This type of claim also is not allowed unless it is reviewed by the regulatory bodies like FDA and Health Canada. So you shouldn't see them unless there is evidence given to those regulatory bodies that those claims are correct. So again, the type of claims made on the supplements can give us an idea how um, trustworthy is these supplements and the manufacturers of those supplements.
And how do you know if they're from unverified sources, and what are the potential risks of purchasing such dietary supplements?
Yeah, I mean, the risks are so many, and they're linked to again the manufacture. Like they can be linked to what I spoke about: the contamination, the incorrect ingredient, the dosage, something related again to the manufacturing problems, the claims, the type of claims, unproven claims, misleading claims. When you see that there are not enough information on the label, on the list of ingredients, also that can be like risky. Um, and I spoke again about the unwanted side effects, the interactions with prescription drugs and with other natural health products. All of these are risks associated with the intake of supplements. And we spoke about many of them before, such as the side effects, the safety concerns, the contamination is another thing that I just mentioned about. And again, the contamination can be whether we're talking about heavy metals, trace elements that are
Mhm.
present there in large amounts and they're not double checked or like it should be a purified form of the supplement without all those extra trace elements and heavy metals. And or the other form of contamination, which is the one I spoke about with unwanted or illegal, actually, or harmful substances that are found in there and that are sometimes added intentionally and other times unintentionally. It can be kind of unintentionally because the manufacturer, let's say, is using the same bench to produce, let's say, a medication or something that contain those prohibited substances, and they're producing the supplements at the same time, and there happen to be some cross contamination, right? Or it can be intentional, where the manufacturers are intentionally putting those substances in there, although they're prohibited, just to boost the performance, to boost the effectiveness of the supplements. And that can definitely harm the consumer uh, in different ways. And that's, again, like extremely misleading. But those supplements, once there is a audit done by
Mhm.
FDA or Health Canada post release to the market, when they discover such things like those types of contaminations, they immediately recall all supplements from the market, which is great. I mean, they inform the consumers, they post about that, and they remove all or recall all the products from the market because they contain prohibited substances. These are the different risks, and again, we spoke about many before, and I added some here regarding the use of
Yeah,
supplements, especially if we're not trusting the source of those supplements.
that's right. And earlier on, we spoke a bit about some common misconceptions. What can consumers do to differentiate between credible and misleading information in regards to these dietary supplements?
That's a great question. So there are lots of information that are posted wherever you are in in whichever country you are. The regulatory body usually they keep a very nice updated website on all those types of recalls they do. And I've checked the FDA. They always post updates on, let's say, the latest recalls they had with respect to the dietary supplement, to certain dietary supplements, why they did
Mm.
the recalls. So it's good for the consumers to keep checking those websites, to check what lately has been recalled, what has been done to, why those products have been recalled, so that they're aware of what's going on and they're aware of the choices to make, right, later. Um, and I always say there are two categories that I always speak about, or three categories. There is the weight loss supplements, and I told you about before. When we're
Yeah.
talking about weight loss supplements, please, consumers need to be very careful when choosing those supplements. There is the bodybuilding and the performance enhancing supplements. This is another category where we're seeing lots of contamination with prohibited substances. And those, again, when I say about those, talk about those contaminations, they can cause lots of life threatening events. They can cause serious health implications. And that's why I say you have to be very careful. They have to be very careful when dealing with those types of supplements, and the botanicals, the herbal supplements. For the herbal supplements, I didn't speak much before about them, but my concern about herbal supplements and botanical is that we have lots of studies on those supplements in, again, animal models and cellular and like in vitro studies. We have very little studies of them in humans. And even if we have studies on them, those studies are not very strong studies, and we cannot expand them to all the populations. Another problem with the herbal supplements is because of this complexity of herbs. Herbs are very complex. They can have million different ingredients in them, right? So if we know about one ingredient, we don't know about all the ingredients in this herb, in this specific herb or herbal supplement. And many of those ingredients, if taken in a concentrated dose or form, they can cause adverse events, right? They can cause
Mm.
side effects in the body. We don't know, because this herb does not only contain one ingredient, it contains so many different ingredients that we're not aware of. We're still discovering. So that's my concern with the herbs, is that they're very complex. We don't know much about the exact composition of each herb. And again, that can be scary sometimes. And also the interaction of herbs with lots of medications we take.
Ah.
The herb drug interaction is very common. Um, and again, we're trying to understand more. And we don't have enough studies on humans, but we know from animal studies and in vitro studies and cellular studies that it exists. So that's another part to be careful about, how it interacts, how those herbs interact with drugs and medications. We need to establish those interactions in humans as well to be confident in our decisions.
Not many people are aware of the existing of recallings and the fact that FDA puts that out. So, what role can healthcare providers such as dietitian practitioners, healthcare providers play in educating patients about the appropriate use of such dietary supplements?
That's a very important topic, Sabrina. And I want to mention that the healthcare profession, particularly the registered dietitian, they are in very they should be part of our lives, because and they should be part of our lives, especially when taking decisions regarding supplements. We should consult with them all the time. Their responsibility as healthcare professionals is to educate consumers, as I'm saying now, about what to look for in supplements, how to check whether the supplement is effective or not, how to know if it's going to benefit them or not, how to know if there might be a risk of contamination or not, right? How to know about the claims and whether the claim is misleading or not, if it's accurate or not. This is our responsibility as dietitians, as healthcare professionals, to educate consumers about that, because they may not know, as you said, they may not know that taking supplements at the same time is might not be okay, right? That we should think about the timing, about the dose, about when to take the supplements, in which form is the best way to take the supplement. So these are, and this is part of my research projects now, is that I try to understand in different studies why people take supplements. I try to understand in different populations, whether athletes, whether exercisers in gyms, whether now I'm going to be working maybe on children and adolescents, and how the supplements they take with respect to different conditions. But and I'm trying and I when I asked those participants questions about knowledge, we found that they don't have much knowledge about these supplements and they want to learn more. And that's why one of my latest project, and I have two publications that were recently published on that, we developed a nutrition education intervention, and we educated athletes for a period of 4 weeks, let's say, on supplements, and we tried to compare their knowledge before and after, and there was improvement in knowledge, right? And that's something that I'm going to try to apply in different settings because we do need um, educational materials on dietary supplements that are well distributed for the different populations at risk of taking supplements, distribute to have those materials available to them, and those materials can be discussed with their healthcare professional to make them more knowledgeable about supplements, about their risks and the benefits of supplements, but also the risks. And this is this is something that healthcare professionals, dietitians can do to educate more those patients on dietary supplements.
And every individual has different unique uh, genetics and genes, right? So, such tests and assessments that take your saliva and check your DNA tests or blood tests, does that give us a baseline on what kind of intake, what kind of dietary supplements, what kind of uh, nutrition that we need to take, or should we, or habitual, as you mentioned just now, the habitual um, consultation about our food intake, is that already good enough for our baseline to
Actually,
understanding
yeah,
this?
this is what we call nutrigenomics, something that is gaining lots of attention, and I have lots of many colleagues who are working on that, which is trying to understand how our genes, gene modifications, interact with the environment, and one part of this environment is our diet, right, or dietary supplements, and definitely we are each uniquely different in our genetic composition and in the way we respond to any form of intervention, any form of therapy, including diet intervention, including dietary supplement. So definitely, there are lots of studies that still need to be conducted in this field, but we have lots of existing studies trying to understand, let's say, how our genes, our individual genes respond to caffeine intake and caffeine doses. We don't all respond the same way to caffeine, right? And it's all
That's right.
because of our genetic composition and how our gene interact with the caffeine and with the doses of caffeine that has been already published. It was done by one of my colleagues at the University of Toronto. So there are lots of studies going on, and we can do that for the different supplements, as you're suggesting, to better understand how each individual's type, gene composition, and gene type interact with those supplements, and that can definitely help us to what we call personalized. This is another topic we can discuss another time. Personalized nutrition. Personalized
Mm.
nutrition is becoming very common now. It's that when I know your genetic composition, I know your metabolic composition, your blood profile, right? I can know what type of diet works best for you. And that's a lots of work,
Ah.
right? There's lots of work that needs to be done to get this kind of information. It's kind of you collect different information from the blood, from the gene composition of an individual to understand better what diet best works for them and what dietary supplement may be effective for them or not. That's a great question, Sabrina. But definitely, and they're trying also to understand in studies, if we want to go back to longevity, there are lots of studies going on now, I read, on how those dietary supplements can also impact gene expressions related to those genes related to our cellular health or our cellular um, I don't know, regeneration ability to become, like, I don't know. So there are lots of studies about, again, at the cellular level, trying to understand how those dietary supplements can affect gene expressions, those genes that are linked to aging, that are linked to longevity. So that's interesting as well. Hopefully we'll get more results soon.
Yeah, lastly, what is the one thing that you hope to see in regulatory guidelines and practices in the dietary supplement industry?
Oh, I work a lot. I worked in the industry before, in the regulatory nutrition science team, and I still consult with lots of supplement companies in general. Especially, I work closely with the nutrition science and regulatory affairs team, um, and they're all companies are, again, are trying to um, they're trying to not release just any dietary supplement. There is more and more movement toward releasing dietary supplements, but also offering, being transparent about what is in this supplement, being transparent about the doses of what is exactly in the supplement, what doses are in there, what ingredients are in there, and having the claims, having not misleading claims in there. So they're trying their best to have claims that are well supported by evidence, not just any claim on the, not just making any claims on those supplements. I think there are lots of efforts being done in those supplement companies to be more transparent with the consumers, making sure that there are no safety concerns, no risks of contamination in there, and there should, like, again, I wish there will be more and more efforts in that direction to make sure that each manufacturing company ensures properly that those supplements they're making are not contaminated in any way with any form of prohibited substance, that are what they're saying is in there without just hiding about other substances that can be in there and not displaying them on the label. So that's what I hope. I hope that every single manufacturing supplement company will be clear, will be transparent, will display everything on the label, will be truthful with the type of claims they're making, and double, triple check that contamination is not there. There's nothing to worry about in this supplement before delivering it to the consumer.
All right. And if our listeners can have one single takeaway, what habits would you recommend practicing in conjunction with dietary supplements?
The first habit is to not take any supplement before checking with your physician and dietitian. That's very important. I keep repeating it. And again, making informed decision by again, when consulting with a dietitian or with a healthcare professional, you are able as a consumer to make better decisions and more science driven and science oriented decisions, which I believe in strongly. That's why, again, consulting with a dietitian and with your healthcare professional is the number one thing you should do when you think about taking any form of supplement, because they can help you make informed and science based decisions.
All right. Now we are going into the segment of open mic where you have the chance to talk about anything that you're passionate about, and it doesn't have to be related to the topic. So, stage is yours, Dalia.
Oh, that's a nice section. Okay, I've been enjoying lately. So I've been doing lots of studies on sports supplements and supplements in the sports field, and I feel that the number one thing everyone should be thinking about, other than supplements, is to how to improve their lifestyle. And this is a decision I made myself. I decided to go back to my childhood hobby, which was playing tennis. And I went back to playing tennis last year, and I love it. I'm so much enjoying it. I feel healthy really in different ways. Um, I feel that I just want to tell everyone who's listening now to go back to something they enjoy when it comes to physical activity, because again, when I speak about supplements, I speak about lifestyle, I speak about diet, I speak about physical activity, exercise. I want everyone to think about something they enjoy, not just like say, oh, I need to go to the gym because everyone is going to the gym. I don't enjoy the gym. I don't like the gym. I want to introduce this activity into my daily life, but not through gyms. So I found tennis to be my passion, like something I would like to, that keeps me moving and keeps me healthy in different ways. So try to find something you enjoy that keeps you moving, keeps you active. It doesn't have to be what everyone else does, something you enjoy, and any form, like anything, and that can help you on top of your dietary choices and lifestyle choices. It can help you maybe live longer and healthier. We're not sure, because there are some studies exploring link between physical activity and living longer and healthier. But this can be a good first step to being healthy overall. Thank you.
Thank you, Dalia, for joining us today and for your insights. If our listeners want to find out more about you, where can they go?
So they can find me on the website of the University of Guelph, Dalia El Khoury. They can find all information about me. My publications also can be found in there. And also I can be found on LinkedIn. I have an account, Dalia El Khoury, Ph.D, if there are other Dalia El Khourys. And this is where also they can find more information about my experiences in different countries, different cities, in different settings. And then there's also a link to my publications in there, and they can contact me through my email, the University of Guelph email, or on LinkedIn through messaging me on the LinkedIn profile.
Thank you, everyone, for tuning in, and we'll catch you in the next episode. See you later.
You have been listening to Aging Less, the Longevity Science Insights podcast produced by LMSL, the Life Management Science Labs. More episodes are available from 10 life management perspectives and can be found by searching LMSL on Apple Podcasts, Google Podcasts, Spotify, YouTube, and other podcasting apps available on your devices. If you enjoyed this episode, please rate, share, and subscribe to our channel so that other people can find it and we can continue to provide quality content. More of our work can be found on our website at longevity.lifemanagementsciencelabs.com, where you can join our movement. I'm Marie Stella. Thanks for tuning in.